until very recently, the health problems of the women in Africa have not received the attention they deserve. Among these problems, perhaps the most important are those related to human reproduction. In the case of the women, it is the problems related to pregnancy, childbearing, and unsafe abortion. Our work as health workers, our creed and credo, is to provide help, to provide succor, to alleviate pain, and to help cure if at all possible. We should learn our business properly. And remember that when people have unsafe abortion, the chances are that society or the health services have failed them by not providing them with the education, the counseling, or the services that they need. Some don't even know that in this day and age, you can prevent a pregnancy. It is up to us to learn how to counsel them, and see that we provide the follow-up service that helps them not to become repeaters. This is the only way we can prevent unsafe abortion. In the rest of this video, Sister Rose Makwenda shows us how she offers family planning counseling in direct, caring, and sympathetic manner to women who have suffered unsafe abortions.
I remember this frightened, very ill young woman who was lying on the bench in the ward. Just looking at her, I felt concerned. I wanted to make sure she would never be in this pain again, but I really wasn't sure how. By the time I found her a bed, the ward was crowded as usual, and I was already thinking to myself that I didn't have all the time to treat all these women and counsel them too. I went to have a chat with her after the uterine evacuation. When she told me she didn't know how to prevent herself from getting pregnant, I couldn't believe it. I thought by now everyone knows about family planning. Besides, I had a crowd of other women to attend to. I lost my patience. I forgot what this young woman had just been through. She had nearly died. I scolded her loudly in front of all the other patients for not at least having gotten some pills from the family planning clinic. I must admit, I let my own feelings of frustration get in the way of trying to understand how she really felt. Then I was pulled away by an emergency. By the time I came to look for her again, she had left with her husband. I never had the time to tell her how to use pills correctly, or tell her about her other family planning methods. I felt very bad. I'm afraid she'll be back with another unplanned pregnancy.
I was born in Mwachipapa, a small village not too far from the city. I was named Mulenga in memory of my grandmother. I went to school in our village, but stopped in grade 6 because my parents had no money to pay for my school fees. I was looking after my young brothers and sisters while my parents worked in the field. When I became of age, my parents got me married to my cousin. I already liked him even before we got married. And when we moved into our home, I understood what marriage was all about. I was very happy. After a few months, I became pregnant. And when Mwape was born, I was so happy to have a child of my own. Before he was 2, I found myself pregnant again. And then a year later, again. No one ever told me how to keep myself from getting pregnant. I was growing weaker all the time and kept getting sick. When I found myself pregnant for the 4th time, I knew I couldn't live through it again. My husband decided that I needed a rest, that I should stop the pregnancy. What looked to be simple became so horrible. Even childbirth had not been so painful. I did everything the traditional healer told me to do. I left the stick inside me like she said, but it did not work the way she said it would. I was losing blood for a long time, and so my husband had to bring me to the hospital. There were so many people there. I waited and waited, losing blood all the time, before the nurses could find me a bed. I thought I was going to die, but the nurses helped me. When the treatment was over, some of the nurses were angry and annoyed with me. One of the nurses who was angry with me said that I should at least be sensible enough to take pills. I was so afraid to go to a clinic, so I told my sister-in-law about it. She gave me some extra pills of hers and told me that I could make them last longer by taking one every 2 days. I started them a month after I got back from the clinic. But the pills must not have been so good, because I'm pregnant again. No one ever told me how soon I could get pregnant after a termination, as the nurses called it. I never even saw my period.
It's easy to forget that so many women like Mlenga cannot always prevent unwanted pregnancy. The reality is that so many women cannot always control when they have sex and when they use family planning. A lot of them do not know how to negotiate contraceptive use with their partners, or they don't have the power to negotiate for it. Sometimes it's just hard for women to get the right information about contraception. Instead of feeling angry or frustrated with our patients, we can help them by providing family planning counseling, by understanding their situation, and by treating them with empathy. Empathy is not just feeling sorry for someone. By empathy, I mean showing understanding, concern, and a desire to help in a way that encourages frank communication between us. For me, empathizing with a woman who's just had an unsafe abortion means realizing that it really isn't her fault for not having enough information about family planning. I can make a difference in preventing another abortion by offering her family planning counseling. She's in a crisis and needs my support to get through it. It's not hard to empathize with her when I put myself in her shoes. Something happened soon after that day when I escorted the young woman from Watch Papa that taught me once and for all to put myself in the shoes of each woman I see. It was another hectic day on the ward.
Sister Rose, I think I've seen your daughter admitted to B30.
What?
Your daughter, I think she's admitted to B30.
Are you sure it's the girl?
Yes, come.
How are you feeling, my dear? I was so relieved. It was not my daughter. The chart showed her name was Charity. I started seeing all the women we treat with complications of unsafe abortion differently.
Sister, I see you really have things under control here. Will you see to it that she gets to the family planning clinic as soon as she's feeling better?
Yes, doctor.
Thank you.
This will give us some privacy. Don't worry. You will be all right now. Charity, how old are you?
16.
Can you tell me how all this happened to you?
When I found out I was pregnant, I told my boyfriend, but he said it wasn't his problem. I pleaded with him, but he said it was all my fault. I was scared my parents would kill me if they found out. They'd spent so much money on my school, so I never told anyone. And then I heard about this man who could help me end my pregnancy before anyone found out. It would be very private, they said, in his office. They said he wouldn't ask any questions or look for any papers. I was really scared, but I finally went to see him 3 days ago.
We had good reason to be scared. You're very lucky. What he did hasn't turned out worse. You will be all right. You were smart to come to the hospital. So, were you doing anything to avoid getting pregnant?
No, I couldn't go to the clinic because I was scared of running into my relatives there. My boyfriend promised he would pull out so I wouldn't get pregnant. He always said he'd get condoms, but he never did.
You were in a very bad situation. You must have been very frightened. When you feel more comfortable, I'll walk you over to see a family planning counselor at the clinic across the street.
Thank you.
When we talked about avoiding sex, Charity thought this may be a good choice for her, especially given the attitude of her first boyfriend. But come back to see us if it gets bright. The family planning counselor will also be talking to her about avoiding sex. Realizing that Charity really could have been my own daughter means that I can't help putting myself in their shoes. When Charity came to us, we were not giving contraceptives right here in the hospital. But since the recent training workshop, everyone working here, doctors, residents, and my nursing sisters have committed themselves to providing family planning counseling. Now, we always counsel women at bedside or in a private room and do everything we can to give them a method before they leave, even when we are really busy. And of course, we are still learning. What happened with Mulenga and Charity taught me a lot. They helped me understand 3 things. When a woman comes in sick after an unsafe abortion, I really need to put myself in her shoes. Putting myself in her shoes helps me to show her concern and support. Doing this makes it possible for her to tell me her personal family planning needs and to hear the choices I'm offering her. Women have abortions for many reasons that are not for me to judge. They could be our sisters or our daughters. Their efforts to use contraception may have failed, or the information they needed may not have been available to them. And I feel more confident in my job when I put myself in the shoes of the woman in front of me. In-service training workshops have helped me learn to do post-abortion family planning counseling by using the letters of the word gather to remind me of the counseling steps I want to cover. The letters G-A-T-H-E-R remind me to greet every woman and her partner, if present, in a friendly and helpful way. Ask her about her current concerns, future plans including children, knowledge of contraceptives. A is also for assess. Assess her emotional and medical condition. Is now the right time for family planning counseling? Tell her about family planning methods that fit her personal and medical situation. Help her choose the method she prefers. Listen and ask questions. Explain how to use the method chosen. And the R in gather reminds me that return or referral visits should be planned depending on the woman's medical condition and her chosen method. In the session I'm about to show you, notice how I adapt the gather steps to assess the specific needs of a woman after her abortion. For instance, whether or not it was a septic abortion will help determine what methods I tell her about. Since women don't often feel like talking or listening much after an unsafe abortion, we need to express our concern for them and assess quickly what each woman needs to know in order to make an effective choice. Hello, Martha. How are you feeling now?
Not so well.
My name is Rose Makwenda. I know you've been through a difficult time. It will be a while, but you will be all right. I'd like to talk with you about how you can avoid this bad experience in the future. Do you feel you can talk now?
It's been just awful. I didn't want my mother-in-law to know about this.
You've had a lot to worry about. Come. Here's an office where we can talk in private. Our talk will be confidential and no one will know what we talk about. Feel free to say whatever you wish. Is there anyone with you who'd like to join us in the talk?
I'm here by myself. My husband is at home with the children.
Okay. A lot of women don't know that. You can get pregnant again almost immediately after an abortion, even before you get your next period. Do you plan to have any more children someday, Martha?
We have 3 children. I can't afford to fall pregnant again soon.
Were you using some kind of contraception before the abortion?
Yes, I tried taking the pill, but I forgot it a lot. Could that be the reason why I got pregnant?
Yes, I believe so.
It is very hard for me to remember taking the pill every day. Sister, is there no other method I could use?
Yes, there are. There are no medical reasons that would prevent you from choosing another modern method of family planning, since you don't have an infection, anemia, or severe bleeding. What have you heard about other family planning methods?
Nothing much, I'm afraid. But my neighbor told me she gets an injection every 3 months. That would be good for me too. Then I won't have to worry about taking the pill every day.
I think that could be good for you. If so, we could give you an injection today. But first, I'll need to ask you a few questions, tell you more about it, so we can be sure it's the best method for you. I'd also like to tell you about some of the other methods available before you make a decision. Feel free to ask me any questions. First, I'll tell you about the injectable and some of the possible side effects. Now that we've talked about the injectable and the other methods, do you still think the injectable is the best method for you?
I really want to try it.
Excellent. I can see you're really determined not to have another unplanned pregnancy. In fact, injections are a very good method after an abortion. Can you repeat what we've said so far about this method?
I would get an injection every 3 months. The one I get.
Very good. And if you have any problems or questions at all before your next appointment, just come back to us. I want to remind you, though, that using injectables does not protect you against AIDS and STDs. Have you been able to talk about this with your husband?
We talked about it when his brother died of AIDS. He's very concerned about protecting his family. I'm sure he's being careful.
It's good you've been able to talk with him about such a delicate subject. So, there are no reasons why you shouldn't use the injectable method. Come, we'll get you your first injection. This scene shows us how we apply the gather technique in a way that fits in each woman's situation. Gather helps us offer the empathetic counseling and the specific information needed by a woman after her abortion and her partner if he's with her. You may want to watch the scene with Martha again. Notice how the 3 essential messages of post-abortion family planning counseling are woven together into the Gather's tapes. After abortion, fertility returns immediately, even before her next period. Modern family planning methods are safe, effective, and available to prevent or delay pregnancy. Exactly where and how she can obtain family planning services. In post-abortion family planning counseling, the R in gather represents referral as well as return, depending on each woman's special circumstances and her family planning choice. It is best to provide the method of choice right at the hospital. But when a woman or couple chooses a method that we cannot provide here, we refer them to a family planning clinic that can provide it. In the next scene, Dr. Omara refers a couple with 7 children. The woman has induced the abortion herself. Notice how the doctor includes the 3 key messages of post-abortion family planning counseling in gather steps that have been modified to fit his assessment of the couple's needs. Much better.
There is still the risk that you could get pregnant again soon after an abortion. For that reason, I'll ask our family health nurses to talk to you about family planning. They'll give you a safe, effective method to use at home after discharge from hospital.
Yes, doctor, we had a talk a few minutes ago with the nurse. My husband and I have decided that the permanent method is best for me, since we already have 7 children. They are quite enough for us.
The nurse also spoke to us about the medical advice that will help my wife get better.
That's fine, although this may not necessarily be the right moment to make the final decision to undergo tubal ligation. Before the procedure is done, you will get more information and counseling at the family planning clinic. The procedures are done on Monday, Wednesday, and Friday mornings. The clinic is located on the ground floor in the blue building in the next block.
Thank you, doctor. I've seen the clinic with the family planning logo on it.
Let me give you this leaflet, which summarizes the medical advice we gave you and also tells you the hours and location of the family planning clinic.
Thank you, doctor.
Mrs. Piri, since your womb is infected, the operation will have to wait for some time until the infection is cleared. This will also give you time to think whether you are making the right decision to undergo tubal ligation. But then there is a risk that while waiting for the operation, you could get pregnant again, even before you start attending your monthly periods. So it is important that you use another method of preventing pregnancy while waiting for the operation. Condoms maybe? Mr. Piri, what do you feel about the use of condoms?
It's okay. My wife's health is very important.
Good. So, the nurse will help you to get some condoms to get you started. Then you can get some more from the family planning clinic or at any other outlet. The routes you used to induce abortion in the last pregnancy caused an infection. Now, let's see if you can remember the medical advice we gave you about how to clear the infection.
I understand I have to take all the medicines that were given to me, even if I start feeling better.
That's right.
Thank you very much, doctor, for the care.
Dr. Omara showed the Piris how to apply a condom correctly. Then the sister gave them condoms to take home.
Thank you, sister. Thank you. Bye.
Post-abortion care should include 3 major elements, which are providing emergency treatment of incomplete and septic abortion and potentially life-threatening complications, providing post-abortion family planning counseling and services, forging links between post-abortion emergency services and the reproductive health care system. This is the only way we can prevent unsafe abortion.
After ending that pregnancy, I wish someone had told me exactly when I should have started taking family planning pills, and that I had to take one every single day. I never knew that I could get pregnant right after what I went through. And I really don't want to have another abortion.
I was so lucky to end up where Rose Makwenda works. She assured me that I'd be all right this time, and that it wasn't my fault. Nobody told me I could use family planning. That really helped me feel better. I left the family planning clinic knowing what to do so I wouldn't become pregnant again.
Over the years, we heard a lot of rumors about tubal ligation. But after the nurse's explanation, we found out that this method is best for us. I'm not worried at all about it.
After Sister Rose showed me all the family planning methods available and gave me a chance to ask all the questions that I had, I found it easy to pick on one method and learn how to use it correctly.
We left the hospital knowing exactly what to do.
Rose really seemed to care about what had happened to me. She made me feel so comfortable with her that it was easy for me to tell her about the situation with my husband and what I really needed.
When I find out the needs and circumstances of a woman in my care and offer her the family planning counseling she needs, I feel much more confident and capable in my job. We all want to prevent abortion. Nobody wants to go through what these women have been through. I will always feel frustrated that I don't have enough time for family planning counseling. But I do want to help keep these abortions from happening. So I feel better when I take a few minutes to offer each woman good family planning counseling. Preventing unsafe abortion isn't easy. But if we learn to put ourselves in their shoes, we can help them for the future. We can make a difference.